There are 10,000 strokes per year in the UAE, of which only a very small number get the appropriate attention and treatment. A stroke is an acute onset, a sudden onset of weakness on one side, loss of language, severe headaches, or loss of consciousness. Whenever the patient or the family considers these symptoms and is concerned about a stroke, they should call the number 999 immediately. What we have established is a very, very close link to the EMS so that we get a pre-notification of a patient that will arrive in our emergency room with a stroke symptoms. That gives us time to organize everything in time so that we are swift in the assessment and providing the necessary care in the chain of survival. It is very important to cut the time from arrival to treatment to the minimum because time is of an essence. So the CT scan allows us to establish the correct diagnosis, and in the case of a stroke, immediate treatment such as intravenous thrombolysis, it's a clot-busting substance, or receive a thrombectomy procedure in a specialized cath lab.
One very important thing that we have to consider is that we've got only a limited time frame, a therapeutic window of 4.5 hours to try to reopen the occluded vessel with these therapies. This time frame is proven to be the safest and still most effective to reopen the artery and try to save brain cells, the neurons, from permanent damage due to the ongoing stroke.
After the initial treatment, the patient is monitored in a stroke unit. A stroke unit is a specialized hospital ward that allows appropriate monitoring of the patient in terms of the vital signs and also the neurological status on a continuous basis. Depending on the stroke severity, patients are either treated in a general stroke ward or in the intensive care unit. Some patients with severe deficits require to be treated in a specialized rehabilitation unit. In this unit, they receive speech therapy, physiotherapy, ergo and occupational therapy to restore their functions. We have a multidisciplinary team of different services along the pathway of a given stroke patient. The ED services, the radiological services, the interventional services, neurosurgical services and rehabilitative services are available for each patient at any time of the day.
It is important to seek medical advice immediately as soon as the stroke is suspected. Don't wait. Remember, as we used to say, time is brain.